Hello everyone, I'm Jessie. In this video, we will study axis of motion of angle joint. Motions of angle joint, dorsiflexion and plantar flexion. Axis of motion. Axis of motion should pass through the lower end of the medial malleoli to the body of the talus and through the lateral malleoli. This oblique axis having a multiplanar movements and this having an orientation from the sagittal plane. At the same time, it is having a slight inclination in the transverse plane, and this coronal axis is posteriorly located in the frontal plane by 23 degree. Reasons for oblique axis. Lateral malleoli is bit more downwards than the medial malleoli. Lateral malleoli is more posterior. Dorsiflexion. During dorsiflexion, there is a slight degree of eversion and abduction occur. Plantar flexion. During plantar flexion, there is a slight degree of inversion and adduction occur. Total angle arthroplasty. At the talocrural level, the Scandinavian prosthesis, which includes star prosthesis, and it is having a mobile component that allows triplanar and multiplanar movement. It is very better than the other systems. Position of the angle joint. Body of talus slightly wider anteriorly than the posterior one. Dorsiflexion is the closed back position or stable position because during dorsiflexion tibia move anteriorly and the wedge-shaped talus is getting blocked inside the mortise. Plantar flexion and inversion in the talocrural joint is less stable because during plantar flexion mortise move posteriorly. So the mortise having increased mobility and less stability. Greater chance of injuries or sprain in plantar flexion and inversion in weight bearing. Osteoarthritis. Post-traumatic arthritis is most common in the angle joint. That is due to some injury. Role of fibula. Lateral facet of talocrural joint is the large one and the medial facet is smaller one. While during dorsiflexion and plantar flexion, greater range of motion is achieved by the fibula and less range of motion is achieved by the medial malleolus. Mobility of the fibula is very crucial for the functioning of the angle joint. Fibula is linked to the proximal and distal tibiofibular joint. Muscles and other structures. Muscles responsible for dorsiflexion. Tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. Muscles responsible for plantar flexion. Tibialis posterior, flexor hallucis longus, flexor digitorum longus, gastrocnemius, soleus, peroneus longus, peroneus brevis. Stability of the angle joint. Medial side of angle is stabilized by tibialis posterior, flexor digitorum longus, flexor hallucis longus. Lateral side of angle is stabilized by peroneus longus and peroneus brevis. Ligament in the angle joint or prevent the side-to-side movement during dorsiflexion. In the next video, we will see axis of motion of subtalar joint. Thank you.